So the protozoa which causing blood infections are first one the Plasmodium. Plasmodium is a cause of malaria. So the malaria is what is malaria? It is fever, irritability, headache, anemia, and splenomegaly. And splenomegaly. So the Plasmodium has a lot of varieties. First we discuss Plasmodium vivax and Ovale. So in the Vivax and the Ovale we have a third day or the tertian fever pattern, a tertian or 48 hour apart fever pattern due to the dormant hypnozoites in the liver. Then we have the Plasmodium falciparum. Falciparum is very much tested. This whole blood related protozoa are very much important. So falciparum can cause cerebral malaria. It can affect the kidneys. It can affect the lungs. Why? Because the falciparum they sensitized, they para they parasitized the RBCs, and the RBCs occlude the capillaries, and this occlusion can cause the kidney, lungs, and brain affected. So parasitize the RBCs, occlude capillaries. It has a very severe irregular pattern of fever. Next one is Plasmodium malariae, and it can cause Plasmodium malaria typical, and it is a quatern or fourth day fever, which is 70 or 72 hours apart. This is the pattern of fever. Then we have it can caused by the Anopheles, female Anopheles mosquito, and the treatment is very much important. The treatment we use the sensitive areas which are chloroquine sensitive. We use chloroquine, and if there is areas which get resistance, we use mefloquine, proguanil, and atovaquinone. There is a very much important line which come in my observation is use mefloquine for 4 weeks whenever you come from post trip from a resistant area in order to eliminate the hepatic schizons which contain merozoites. So for this is for resistant and sensitive. Whenever there is a G6PD, always test for G6PD deficiency before using these medications. And then for Plasmodium ovale and Vivax, we add primaquine for hypnozoites, for the dormant hypnozoites. And whenever there is G6PD deficiency, if the patient is life threatening, use IV route, and use artesunate and quinidine. So on microscopy, we have pictured two things. First, there is uh, on blood smear we see trophozoites, trophozoite ring in RBCs, and also we see Schuffner's stippling throughout the cytoplasm, Schuffner's stippling throughout the cytoplasm with the Vivax and Ovale, and then we see schizons carrying the merozoites and granules. So this is all about Plasmodium, and the next uh, protozoa is Babesia. Babesia. Babesia can cause hemolytic anemia, and also fever, hemolytic anemia. Babesia can have the maltase cross. The maltase crossed or the ring form, and it is the most common in northeast US areas, and it can caused by exotic, which can also a vector for Borrelia and Anaplasma, and the treatment of choice for Borrelia is atovaquone and azithromycin. So the complications are acute respiratory distress syndrome (DIC), especially when the patient is asplenic.